We have had 14 times the number of people in hospital with COVID than we saw this time last year, and we've also had a record number of A&E attendances and indeed a record number of 999 calls. So as we look into winter, I think we're very clear, this is going to be a difficult winter, and the things that we would encourage people to do is anything that they can do to protect themselves. So that's the COVID vaccine, it's the flu vaccination in particular.
Confusing public health messaging from government, because on the one hand is concerned about the level of COVID infections and really urging everyone to have the vaccination, but on the other hand it's telling people that they can actually mix freely without any infection control measures, and they can actually mix without face coverings, without physical distancing.
I think we were a long way away from thinking in those terms. I think that, clearly there is a situation that if the NHS is under severe pressure, if the number of deaths sadly starts to increase, then of course, obviously, there may be discussions around whether more restrictions need to come in. I would hope that with a very successful vaccination campaign, the idea of a winter lockdown is a long way away, but it is certainly true that if we don't get good immunity across the population, there may need to be perhaps further measures taken. So it's really important, as I said earlier, that we encourage people to come forward when eligible to take those booster jabs.